And you are good to go.
Hi, everyone. Good morning. This is Andy Agwunobi, the Interim President. I want to welcome you today. It's, as you know, it's July the 1st, and I hope you're having a wonderful start to the summer. I'm excited about to have this faculty and staff town hall. I know there are a lot of questions because these are uncertain times with information changing constantly, and people are trying. All of you are, and everyone, I think, across the country, in fact, are trying to prepare for what universities are trying to prepare for the fall, and we are too. So we're excited about being able to answer questions. You know, the more communication we can have back and forth, the better. And I want to emphasize that we're also interested in suggestions as we move forward, and you know where to email those and make sure they get to us. But for today, it's about us answering questions. We have a lot of questions. I think we have over 30 questions that we're going to try to get to in this next hour. So we'll be moving as efficiently as possible, trying to get to that. We'll also be taking new questions that you might have. So you can send any questions to communications@uconn.edu. And so we'll try to take questions as well. So we're going to have to move very quickly. I'm joined today by panelists who are essentially administration and others, academic leaders here from UConn. And so we have Carl Lejwe, our provost. We have our leader of HR, Chris DeLillo. We also have Dr. David Bannock, who is our infectious disease specialist for UConn Health and has been immensely helpful. We have Ellie Doherty for student affairs. We have Hans Reinhardt, leader of public safety. We have our labor relations leader, Karen Buffkin. We have our VP of research, Radenka Merrick, our leader of IT, and various others. So I know I'm missing people, but I just wanted you to know we have a lot of people here to help answer these questions. So with that opening, I'm going to turn it over to Tyson Kendig, who's going to sort of help us keep us on track. And we'll go ahead and start to answer the questions. Some of these questions we may have more of a discussion format as we're answering them. It's really about transparency and openness. It's not about having the perfect answer to every question, but hopefully we will be able to shed some light on areas of ambiguity. So go ahead, Tyson.
Thank you, Dr. Andy, and welcome to all UConn faculty and staff who are joining us. As noted, we've received several questions submitted in advance. We'll be dropping in questions in real time. Hopefully, we'll be able to address all of them. And in the interest of time, we may try to merge some similar questions so that we can try to get through as much content as possible. And we're also making a recording of this town hall available on YouTube for anyone who's unable to join live right now. So we will jump right into it. Most of the questions we've received have involved telecommuting, so we'll start on that subject. Can you explain the reasoning behind the decision to revert to the pre-COVID-19 telecommuting policy and process? Departments have made large strides in advancing their operations to accommodate telecommuting for staff. Why not alter the policy to allow for more departmental flexibility and authority to allow for work arrangements?
Thanks, Tyson, and good morning, everyone. It's Chris DeLillo, Chief HR Officer, and want to just make a few important introductory comments about our expectation of telecommuting and the process in the forms that were in existence prior to the pandemic never really went away. They were relaxed, but more importantly, when they were relaxed, I have to congratulate all of our managers and employees throughout the pandemic that really not only were addressing flexibility, but were meeting the operational demands at that point in time. And we have an expectation as we move into this fall semester that type of flexibility and approach is still both welcomed and expected. So as managers and employees work through the operational demands at reentry and throughout the semester, we really don't envision that everyone's going to be coming back on August 15th, and that there will be a phase-in approach for managers and employees who have to meet growing business demands throughout the semester. But more importantly, if there's positions and roles that both the manager and the employee are confident can be done through telework. We want to make sure that the university position is and their expectations will be that indeed will be the case. In the next week or so, you will be receiving communications from HR, both for managers and for employees, to help guide you through that process. And Carl, I don't know if you'd like to add more to that.
Yeah, I actually had a conversation with the deans this morning, and so, it's the same throughout as Chris said, but I'll just refer specifically to the academic side. They understand and agree with what Chris has just said, and they will be working with department heads to try to ensure where flexibility is what will work, and it is the right thing to do, either pedagogically or for the work that we're doing, that we are supporting that.
And I would like to maybe complement that to say the fall is a transitional semester. We know we're going to learn a lot through this semester about what reentry really looks like, what are the expectations throughout the semester. And I think that will also help and guide us through what 2022 will look like for all of us as well. So we expect a lot of learning, a lot of growing, and by staying in communication with each other, I know we'll work through the demands of the semester.
Chris and Carl, I'm going to keep you on standby because most of these questions will probably be most within your respective wheelhouses. Where is the implementation of the Work-Life Committee? Can you share their final recommendations?
Sure. I think we're talking about what was called the future of work. And the group, we had over, I'd say approximately 46 campus representatives. Roughly 10 of our colleagues were from our union workforce. And they came together into 5 working groups and did an amazing job of helping us build out recommendations. And that actually is going to serve us well as we communicate with you after this town hall. They created, dare I say, a rubric of how managers can go through and think through questions in a fairly logical order. And many of you are already doing that. I know that. But I think providing that guidance was really important. In addition, in the last few weeks, the state of Connecticut has issued some guidance to many state agencies about how they're approaching telework in some of the other state agencies. We're assessing that to see how it may inform our approach as well, taking into account the future of work recommendations.
It's a multi-part question coming here. I've heard of some employees being denied the opportunity to continue to work from home after we return because they do not have kids. Will the fact that someone has children be the only consideration of whether someone can continue full or part-time work from home or not? What will the process be to make a formal complaint if someone is denied the opportunity to work from home, full or part-time, and the employee feels the denial is unjustified?
Certainly. I'll try to be as brief and crisp as possible here. Managers should not be making a determination regarding telecommuting based on an employee's marital or family status. So I want to make sure that people understand that first and foremost. The interim guidance that we'll be providing to managers goes through the idea that operational demands need to be assessed first. And then the determination will be the employee's ability to fulfill those responsibilities. And we recognize there are some employees who have to be on campus to do the work of the primary functions of their jobs. And to our earlier statement in the introduction of this town hall, we recognize there can be flexibility given to others. However, employees, for example, without children should not bear the responsibility of all the on-campus responsibilities of a functional area.
So let me jump in here because I think this is an important question, and it was pointed out earlier, we were looking through some of the questions and trying to figure out the best approach to some of them. And I think what I'm generally hearing, and it's understandable, is people saying, well, what are the criteria that will be taken into account when I, as an employee, I'm requesting that I would like to work from, I would like to work remotely or continue to work remotely. What are the criteria that are going to be taken into account? And if I don't agree with that, how am I going to, you know, what's the process for me to raise my concerns about that? And I think, you know, one thing that we have to, I think we all know instinctively, is that there are so many different scenarios that could cause a person to say, I want to continue to work from home. So many different scenarios, whether it's children at home, whether it's family members at home, whether it's illness that the person feels that they have, whether they're just, you know, worried about coming in, whether or not they feel like it's a better way to deliver the services. There are so many ways that, in actual fact, there's no way that any organization, not just the University of Connecticut, there's no way that any organization can have guidance for all of those scenarios in advance. So I think what the way we're approaching this is to say, well, number one is that the managers, whether that's on the academic side, it's deans, or whether it's in, you know, public safety, it might be a manager there or whatever. The managers are closest to the work, closest except for obviously the employees doing the work. They're closest to the work, so they're best able to look at a situation and say, yes, this is something that lends itself to being able to continue to work remotely. Now I should mention, if it's a medical issue, it goes through the ADA process, not through the manager. It goes through the ADA process. But if it's a non-medical issue, which is really what we're talking about now, it goes through the manager of that area, because they're best able to say, yes, that will work, no, that won't work. Now, one of the main factors they have to take into account, like all of us do as leaders, is the mission of the organization and the quality of the service that we're providing. On the academic side, as Carl, I think we'll speak to right now, we're talking about the learning environment, the pedagogy, all of that has to be right. Then there are other factors that will come into play. And our hope is that with guidance, and there will be guidance provided to managers in general guidance, not specific guidance, that managers will make the right decisions. And when there is a challenge, when the manager has difficulty making a decision, that manager will do what managers always do with difficult decisions, and that is they will escalate those decisions. Now, in terms of what about an employee who receives a response that they do not feel is just or fair or accurate? How do they how do they get that? How do they appeal that? I'm going to turn it back to Chris, but my gut feeling is that, that employees, staff members, faculty, even today, if they disagree with a supervisor, there are mechanisms to be able to appeal that. I think we're loath to, at this point anyway, and we're constantly open to discussion. This is a bi-directional discussion. But creating different panels of different mechanisms of appeals feels a little bit like it will just be sort of creating complexity. But I'll turn it back to Chris and see, Chris or anyone else on the panel, if you have thoughts on that. Chris?
Yeah, I'd like to say, and I appreciate all those comments, Andy, and thank you. They were important to hear. I think with regards to appeals and grievances, I would hope that we wouldn't get to a place where we would even get to that place. So I think first, to your point, a manager is doing what they always do, which is going to the next level of leadership to help think through the process is a really an important step. Where that goes to the next level is HR and our employee relations office is very willing to work with managers and employees where there's a decision that people are uncomfortable with. I think that's the first step.
Okay, yeah, thank you. So I think that answers the question. And Carl, did you have anything to add on the academic part?
Just add that, getting back to the future of work question, that we will use those recommendations to make some of the decisions and then recommendations about how managers will approach this, the guidance. And so just to come back to that point of how are we using that information, that will be really crucial in that. And as we do that, we'll share more of that. But it's really the same across the academic as the other parts of the university.
And I just want to emphasize that I think what Carl said is so important, is that the future of work did come out with a lot of thoughts around this, and I think a lot of them lend themselves to being are sort of guidance for managers in terms of how you generally approach, not specifically, not whether someone has children or doesn't have children, but how you generally approach that transition back to work and questions around it. So let's sorry, I know we took a little bit longer on that question because I think it's a central question. I don't know if anyone else on the panel has any thoughts before we move to the other questions, which we'll have to do in a minute or so for each.
I'll chime in just for 30 seconds and say, I manage a large team and I'm dependent on even larger teams who, and I'm thinking of Fac Ops and others right now, who know they need to be on campus and they need to be in person to do the work that we're obligated to do for students. But with that comes the need to really talk about what your own apprehension is with your manager and put together a plan that allows us to fulfill our obligations and come back in a phased approach that that gives you confidence as well. And so I really want to encourage those conversations with managers. Let's put together a plan. Let's use this month to do that. Let's get it reviewed by HR and let's get back to the fall comfortably.
Thank you. All right, Tyson.
Okay, thank you all. For those employees with children under the age of 12, if their schools do a distance learning quarantine, will employees be permitted to telecommute during those times, or will they have to take accrued time off? Chris, that's probably yours.
Yeah, so I think in that situation, again, employees should work with managers. If telecommuting is possible, just as it was during the pandemic, that should be a consideration. Clearly, with the campus reconnecting, and managers might be having a harder time being able to provide that flexibility that they've had during the pandemic. In all transparency, we know that some cases might need to go to accrued time.
Thank you.
What is the difference between flexible schedule work agreement form and telecommuting agreement form when considering asking for approval to work from home? What are the reasons for being eligible for either agreement?
It's a complicated question that I'll try to answer in 4 sentences or less. But telecommuting really permits employees to work away from their regular on-campus department. I mean, that's just a clean way of saying it. We know that by the very nature of some work, as I've mentioned, there are people who can't do that. But employees who can telecommute on a part-time basis, if their job function can be performed away from their department, we want to be able to continue to provide that flexibility while meeting the on-campus demands. A flexible schedule permits employees to work in other than the university's regular business hours. So, for example, 8 to 5. So without a flex schedule in place, employees would be expected to work the regular hours. But with that agreement, that flexible arrangement can be achieved.
Great. The telework transition was signed June 16th, and some unions are using it for guidance. Will UConn have this type of guidance as well?
Yes, as I mentioned to everyone, our goal is to, after this town hall, I suspect it will be next week, toward the end of the week or early the following, we're going to be issuing the telework guidance. We're providing both interim guidance for the fall semester with a form revision, and we'll continue to assess that. There's a possibility that after the fall semester, there'll be yet another iteration. We want to stay flexible with that. So let's talk about the telework transition that was signed at the state level. In our view, it does not apply to us. It certainly informs us. And the guidance was really important to receive from the state that was sent to the other state agencies. Please note that that telework transition agreement is only in effect until September of 2021, which is more important for us to really think through what our needs are going to be throughout the semester. And the state also is going to be reevaluating that guidance to see if they should extend it, but I cannot speak for them.
Okay. I've had a handful of questions come in about vaccines and COVID variants. First one is, will employees be required to get the COVID-19 vaccine in order to return to work? If so, and the employee chooses to not be vaccinated, what will happen?
Right.
Andy,
Yeah.
I'd be happy to have you take that, but
Yeah, so at this point in time, as many of you have heard, if you were listening to the board meeting yesterday, we are, like many organizations, we're evaluating whether or not staff and faculty should be required to take the COVID-19 vaccine. No decision has been made at this time. One of the questions I think that's coming up later on is saying, well, what factors are we taking into account? And so right now, what we're doing is we're number one, we're planning to survey the employees. We just decided that today, actually. We're going to survey the employees and figure out how many people are actually already vaccinated, so that, and how many are not, so that we understand that. We did that with the students. We knew how many were vaccinated. It was the low 60%. And we needed to get that higher. So that's one baseline that we have to understand. We need to understand how many people, how many of the faculty members and staff members are willing and ready to receive a vaccine if they haven't already received it. So that gives us a sense of what the tenor of the faculty and the staff is around this. We're talking with the state because obviously we're all state employees, so we need to make sure that we understand what the thoughts are at the state level, because we always need to be, whatever we do as a university, we need to be at least in alignment, or at least understand what the state is thinking about these topics. And of course, we want to have continued discussions at the right time with union leadership. So there are some factors we have to take into account. I may have forgotten some of them here, but those are very important. So in terms of the question about what will be done, I think it's premature at this point to answer that. But I will say, if you look at what happened with the students, we required vaccinations, and then we said those who are seeking an exemption can request an exemption, and but there have to be certain precautions that are taken, and we may model it on that. But again, decisions haven't been made at this time. I don't know if anyone else has any thoughts on that. Otherwise, I'll turn it back to Tyson.
Okay. What questions about COVID-19 vaccinations are faculty and other supervisors allowed to ask their students and staff?
Good question.
So I can talk about it in the workplace. At this time, employees can always voluntarily disclose their vaccination status to their coworkers and managers. However, managers and other employees cannot take it upon themselves for themselves or the university to ask if a coworker has been vaccinated. Only the university can do that, and at this juncture, we're not doing so. We appreciate everyone's cooperation. I know it's a stressful time, but in situations where people would like to take their masks off and don't know if the person that they're with has been vaccinated, I would assume that that you should just assume that they aren't and wear the mask.
So let me just try to clarify a little bit, just to add to that. Well, first of all, we have not asked employees and staff and faculty at this time, but we do intend to, as part of our evaluation for vaccinations, to determine whether or not we want to implement required vaccinations. We need to understand who is vaccinated and who isn't. So we intend to do that. I think, Chris is totally correct in what he's saying about, we don't want, it's obvious, I think, to everyone, we don't want a situation where individuals are taking it upon themselves to be questioning people about whether they're vaccinated or not. We don't want to create, a difficult environment for people. Now, having said that, I think what happens in practice, in a lot of situations, like we talk about exceptions, like in offices, etc. My experience has been, and it's probably other people's experience, is that when people tend to often volunteer that I'm vaccinated, and obviously I'm vaccinated, and that's fine. But certainly if someone, does not want to disclose that voluntarily, I think that we're discouraging people asking, because it can become a difficult situation.
A couple questions that just came in on this subject. Who do I report to if an unvaccinated coworker takes off their mask in the presence of other vaccinated coworkers? Is it the responsibility of the supervisor to enforce the policy of being masked inside the workplace?
That's a good question. I don't know if HR wants to speak to it, or if David. I know that on the UConn Health campus, we when we have situations like that, it is reported. Typically, it's reported to our infection control, but I'm not sure what we would do on the UConn campus. Any thoughts between David and Chris?
Sure. In that situation, assuming someone emphatically knows that someone hasn't been vaccinated, which I can only presume is because that employee voluntarily addressed that with the person who's brought this question forward. I think that the logical chain of events, if they're feeling uncomfortable, is to talk with their manager, right? And in circumstances like that, I fully expect that a manager would reach out to HR to figure out what would be the appropriate next steps. I see Karen here from Employee Relations to see if she has anything else to add.
No, I think you covered it. I don't have anything additional.
And I think the only thing I would add to this is I think we also have to be kind to each other. We're all humans. There are times where someone who may, and again, you wouldn't know the person's vaccination status, but there are times when even vaccinated people who are in situations where they should be wearing masks might forget to put their mask on. I've gotten out of my car, UConn Health, we wear masks, all the time, outside, everywhere. And I've gone out of my car and got to the building, and I've done this even in a grocery store without my mask on because I forgot. And a lot of times it doesn't take anything more than just saying to the person, "Oh, you forgot your mask," and that solves the problem, as opposed to reporting. But there may be situations in which reporting is the proper way to go.
And I'd also like to volunteer. There are some other avenues, and I'll take it upon myself to say, if anyone is in an uncomfortable situation and maybe doesn't even feel comfortable approaching their manager, I'd always welcome someone to reach out to me, and I'll work with my staff to see how we can work through that situation. As well, we have many inquiries coming in on a daily basis to the HR email address, hr.uconn.edu. And I'd reference the website that HR has. If you forget that link, go out to it, and feel free to email us, and an HR colleague will respond.
Thank you. Now, Tyson, I know we're at the half hour and we got a lot more questions. So I think we're going to have to move kind of almost rapid fire through these questions. And we'll pause on the ones that might be more difficult, but go ahead.
You read my mind, Dr. Andy. How can I encourage a coworker to vaccinate? We actually got this question during the student town hall as well. I think it's a good one.
Dr. Bannock, do you want to take that?
Sure. So, I mean, I think what we're seeing with the vaccines is that they've just been incredibly effective. They continue to be effective, even with Delta variants and the variants that we've seen thus far. They prevent individuals from becoming sick. They prevent transmission to others. Even if you do become infected after a vaccine, it's typically asymptomatic or mild infection. But they reduce the spread. So they're really critical on both an individual level to protect individuals, but also to reduce any spread within the community. So yeah, I think only positive things about vaccination that we're seeing at this point.
Dr. Bannock actually teed up the next two questions, which were about the Delta variant. Is there any concern about the rising cases of the Delta variant? Does bringing back faculty, staff, and students at the same time raise any concerns? And to that end, would telecommuting ever be extended?
So I'll address the first part of that question. So the Delta variant, in many parts of the United States has become the dominant variant. Not quite here in Connecticut, but it has the potential to be increasingly prevalent in the future. And I think, fortunately, among vaccinated individuals, the risk is very low. We aren't seeing individuals hospitalized, becoming sick with the Delta variant who are vaccinated. Seems to be quite a rare situation. Those who are unvaccinated, there is risk there from this Delta variant. And I think that just further emphasizes how critical vaccination is to protect us as individuals, but also to protect the whole community.
Go ahead, Tyson.
There was a question about if we would consider extending telecommuting if those cases continue to escalate.
Yeah, I would just say that all of the guidance that we have issued so far and that has been issued to us can change. And it's a fluid situation. If we end up, we could, before fall opens, if there was another surge, we could be back to where we were, 9 months ago. So I think I don't think that will happen, and I'm optimistic it won't happen. But yes, anything can change because what our prime goal is to keep everybody safe. That's first of all, and we'll do whatever we have to do to make sure that staff, faculty, and students are safe. Fortunately, the positivity is low. It doesn't look like we're going to have another surge. But if that occurs, then all bets are off, and we'll change our guidance. But it's also a reason why vaccination is so important, because that helps to keep us all much safer. But go ahead.
Okay. Several questions on meetings, gatherings, and classes. First one is probably for ITS to handle. Is UConn prepared to offer meeting space that will allow for hybrid meetings? Will departments and units be charged for utilizing such space? Michael Mundrain, do you want to take that one?
Yeah, so lots of the space on campus is already spoken for, but ITS has worked with departments all over the university to build technology-equipped conference rooms, and these conference rooms are capable of supporting both on-site as well as a remote presence. You can utilize your own conference room, or you can borrow somebody else's conference room. And if departments are concerned or they're unable or unsure on how to set up a WebEx or a team meeting, we can work with them to facilitate that.
Okay. We have three questions that are pretty similar in nature here. We can probably merge together. Will there be guidance released about public-facing university meetings and events either on or off campus? And will we be having in-person events in the 50 to 75 person range indoors this fall? That perhaps is one for environmental health and safety.
We're currently working on finalizing our guidance for those events, but generally, as we are working toward reopening our campuses and having more and more folks on campus, what we are going to emphasize are some of the rules and guidance that the university will put out around mask wearing, social distancing, hand washing, those types of areas. So as we repopulate our campuses, we're really going to emphasize some of those preventive measures to help prevent the spread of the disease.
Thank you. Carl, do you want to add anything to that about conferences? I think I'd heard Chris say at an earlier meeting that we will be issuing guidance, more guidance as time goes on. But Carl, any specific thoughts on this?
Yeah, so we want to support things being as back to normal academically as possible. And so if there, if there are potential events that you would like to have on campus, there will be ways where you work through your supervisor and make a request for that, and where we're able to support it, we will. I mean, there will be additional guidance coming on it, but right now, we want to get things as back to that normal setting as we can. Of course, we have to be within state guidance and the other guidance that comes out from the university, but generally, where we can start to get back in person, we would like to.
Yeah. Thank you.
Can you provide more specific guidance in terms of the extent to which faculty are going to be expected to provide full access to in-person classes to students who are not on campus? Perhaps that's one for the provost or the dean of students.
Yeah, I can take this one. And I'm really happy to be able to kind of share this again. And so, as we all know, the decisions about the modality any individual is teaching in were decisions that were made with the department head and the dean in terms of pedagogy. So now, but this is a specific question about if you were in an in-person modality, will you be asked to offer this virtually as well? And the answer to that is emphatically no. Now, you have the option to do that, and for some of us, that may make sense to do that. It may make sense pedagogically, it may make sense in terms of supporting the student, but we know that there's very clear data that teaching a class in two modalities at the same time has very questionable outcomes. And so we are not going to mandate any faculty member or instructor of any type do that, but we want to support it where someone is willing to do that and feels like they can do it well.
And I think from the perspective of the Dean of Students office, we will return to doing what we've always done. So if a student was out with the flu or mono or anything else where they were going to be missing a week or more of class, one of the staff in the Dean of Students office would work with that student. We would reach out to the faculty member and we handle it individually. Last year was a time of much more dramatic measures, but particularly with the student vaccination requirement in place, we don't think that's going to be happening at that scale.
Great.
Let me just jump in here real quick as well, because there's a later question that's really the same question, but from a technological perspective. And so what I would volunteer is that in preparation for this year, we provided technological improvements to all the classrooms. And so the classrooms have the capability to support both lecture capture, as well as if somebody wants to operate in this dual modality of providing both on-site as well as remote. And so those capabilities are there if it makes sense to a faculty member pedagogically. We just know that the feedback is to do that simultaneously is very difficult and is not as attractive under most circumstances.
Thank you. Provost Lenchway, these next couple questions are probably for you. If a department is planning to hold in-person graduate student orientation and graduate student meetings with about 75 students total, are there any special permissions that are needed?
So we would approach this in the same way that we'd approach a class or really anything else. And so it would be important to talk with your department head and potentially your dean. CETL is also available to provide support, and also the dean of the graduate school. But if this is a case where if there's a masking requirement at that time, the masks need to be worn, but we will not be having, it looks like, social distancing. And so we do want to support having those sorts of orientations if they can be done in a way that's safe and is within wherever those current guidelines are. Right now, I could see a case where that could happen. Now, what might be very reasonable to do is to pick a larger room than you might have used for that in the past, or to say for this one semester, we're going to stay virtual with the idea that we're transitioning. But for those that would like to do it in person, we'd like to find ways to support you doing that as long as we're staying within the guidance.
When will extension centers be able to reopen to the public? What will be the masking requirements for visiting clients and/or program participants?
So this is something that would be very important to work very closely again with department heads and the dean of Connor, who oversees all of the extension. But for the most part, we are moving forward with getting extension back up and ready, and in most cases, extension should be functioning very comparable to pre-pandemic.
Great. Exceptions for faculty re-entry have been in place since May. When, if ever, will the plans for staff exceptions be made available?
I mean, I can just probably clarify something in terms of faculty exceptions. There are not health, aside from ADA, there are not health-related faculty exceptions that have been put in place. It's been based on, for classwork, it has been based on pedagogy and based on what is in the best interest of the unit. And so my sense is we are pretty comparable in terms of what we have in place for instructors and for staff, but I'll turn that over to Chris if he wants to.
Carl, I'm in complete agreement. The same approaches with regards to ADA, which really focus on the employee's health, is what we have available at the present time. And it is comparable.
Some of the answers so far have already touched on masking and office space, but I do think there's a few that are specific here we should go through. Will staff have to wear masks when they return for the fall 2021 semester? If so, do you have an idea of how long this will be necessary?
Yeah, so I think I think the guidance was issued in the last letter, and I want to be careful to quote it correctly. But it does not have masking for outside, but has masking for inside, except for some exceptions that relate to enclosed spaces where you either have one person who is sitting on their own doing work, or you have enclosed spaces where you have a group of people, but they're vaccinated and they're able to social distance. I think those are the main exceptions. I don't know, Chris, do you want to keep me sort of accurate on that?
In summary, Andy, you're absolutely correct. And so I think the question was, will they be required to wear a mask? In Andy's points, indoors in accordance with that guidance, yes. For how long, I think is yet to be determined. Clearly, the campus community is focused on well-being and health for everyone, students, faculty, and staff. And I know Ellie, I see her, will agree with that. And, as we know more following reentry, there is a process in place where there's a number of people looking at when will be the appropriate time to take off the masks.
A good segue there, Chris. Should the university eliminate or relax the masking requirement, will individual staff members be able to require masking in their own offices?
So when that comes to be, I believe, and I can, Andy, if you want to chime in, my expectation would be we would hope that all faculty staff would follow the university's guidance on whether or not masks stay on or off. If there is a situation where someone's uncomfortable with that approach and wants to talk with HR, there's avenues in which to do so. I can't think of a case where someone would require masks in that event.
Yeah, I think that's fair. And the only thing I would add to it is that, I don't know what others think, but I can foresee a situation in which even in the future, there are going to be people, whether they are vaccinated or not, who are going to want to continue to wear masks. And, we're certainly not going to be telling people you cannot wear a mask unless that's a detriment to the mission or to the quality of of the service that we're providing or the education that we're providing. So that's one important point, I think, is to understand is that despite the guidance, for example, if we say, well, as we've said, when people come back in the fall, they don't need to wear a mask outside. But if you want to wear a mask outside, you can. And so just something to emphasize there.
And that's a great point, Andy. And, in in the thought process that we all value, that this university stands for, no one should feel stigmatized if they wear a mask,
Okay.
in that situation.
I think we've already answered this question in a couple different ways, but just to emphasize, will vaccinated faculty be allowed to remove their mask during an indoor lecture if they are more than 6 feet from students?
Yeah, this is a great question, and it's a question that came up during a meeting that I had with leaders of AUP, and I committed to them that we would go back and look at this. And the question that really came up was, you know, if someone is teaching and they're vaccinated and the mask is going to impede their ability to teach, shouldn't we be revisiting that and looking at that? So it's something we'll look at. We don't have, I think, a decision on it today, but certainly something that we'll get something out about that soon. Carl, did you want to say something?
Yeah, and I will share that last year we had about 20% of our faculty teaching in person with a mask. I taught FYE in the fall and in the spring. I had 70 students in the fall and 20 in the spring, and I wore a mask, and I was able to try a few different masks, and there were ways to communicate quite clearly. I will say, though, we appreciate this is an extra challenge, even if it is going to be just for a few weeks. And so CETL and Christy Henderson are working on a communication that will go out probably the middle of next week that will address this issue, provide some guidance on best practices, and we'll also discuss how you can request one of the face shields. So that is a way in which you're able to still see someone's lips. It doesn't cover your mouth in the same way. We will find strategies to help you have the right mask to be able to do this. And we will help you find other strategies to make your class work as well as it needs to be. If other things change, then, we certainly should have those conversations. But if they don't, we can certainly help you be effective in those few weeks.
Thank you,
That's
Carl.
a great point, Carl. And anyone can always reach out to the ADA team in HR. Throughout the pandemic, many people came to us about the types of masks that they may have been in conflict with. And I can tell you in about 99% of the cases, we were able to find substitutes for them, in addition to the great work that CETL and the academic areas have done.
Thank you.
Great. We have a little more than 10 minutes left, roughly a half dozen questions left about general campus environment. And we're getting lots of these questions. What is the university doing to address ventilation, air filtration, and air quality as it relates to COVID mitigation in buildings around campus?
Yeah, Emily.
Tyson, I can take this one. Terry Dominguez, Director of Environmental Health and Safety within Public Safety. So we've been working with our facilities partners, and so as no one from facilities is on the call, I'm happy to let you know what they're doing. So they are, making sure that they're keeping up with the preventative maintenance for all the HVAC, the heating, ventilation, and air conditioning systems. They're looking to see where they can to enhance filtration on all these units, so to increase the MERV rating, as they call it. As well as leveraging the outdoor air capabilities as much as possible. There are some spaces that they've identified where outdoor air is not being provided to some classrooms and teaching labs. And so they've made sure that they purchased a number of units, air filtration units, to address these particular locations. So we also have stood up some guidelines, some informational on ventilation on the EHS COVID resources page, which you can get to through the covid.uconn.edu. And so if people want to have more information about the ventilation strategies, they can certainly look to that.
Great.
Sorry, just real quick. Sorry, I will share that Mike Jednek from Facilities Operations came and gave a presentation to both the academic planning group that has the SEC chair on it and multiple constituencies, and to all of the deans and regional campus directors. And at the end of both meetings, I asked, are there any questions or concerns based on this information? And there were none, and that never happened. So it was a very thorough and thoughtful presentation. And I think there's really good strategies to make the most of the spaces that are where they need to be and to bring in those outside filter systems where there isn't.
When will we hear a policy on campus visitors for events? Many employers are calling about an in-person career fair and are anxious to come to campus for other recruiting opportunities as well.
I would hope in the next few weeks, as we have finalized some of the guidance that we've issued earlier in the week, we can take that guidance and use it to build upon it and come up with our visitor guidelines for the fall.
Thanks, Hans. When will faculty and staff be able to use the recreation center?
As a matter of fact, just earlier this week, our leaders of the rec center and student affairs reached out to me and were inquiring about that. And I've had an opportunity to share that with Andy, and Andy in turn shared it with Dr. Bannock. And there is some responses that we need to work through with student affairs. But the goal that I understood that they intend would be for August, and with a communication, I think targeted roughly about the middle of July. So we're working through that, but that's in play.
Okay. Will there be any changes to parking, and when will information regarding parking passes be available? I'm not sure if there's anybody on the panel who's in the best position to address that. I know an email did go out yesterday to anybody holding a parking pass indicating that the expiration, which was yesterday, has been extended to the end of July. So more information is coming on that. But if anyone else has anything to add, feel free to do so.
I would just say there's a number of questions coming in around parking. I think it's probably best that there be a separate communication about that. And I know that Mike Jednick and his team are very on top of that and are working through that.
Great. We have had a couple questions come in real time before we wrap up, so let's try to get to those. Will labor relations ever overrule a manager who has approved telecommuting? I plan to allow my staff to telecommute in some way, but they remain fearful that labor relations will deny what I have approved.
If it meets the university's guidelines, we would not overrule the manager's decision with regard to telecommuting. But those decisions, when they occur, are usually when the guidelines are not being adhered to.
Thanks, Karen. Are graduate students required to be vaccinated or request an exemption and report this to student health and wellness? If so, how is this being enforced and communicated to supervisors, especially those who may want to use mask-free working spaces like in an office or in a research lab?
So a student's vaccination status is something that is reported, different than employees, and that is maintained within the student's record within SHAW. So that is not something that the university would be publicly sharing beyond that medical context. We would then defer to whatever prevention measures are in place within that setting, and unvaccinated students will also receive specific guidance from SHAW on what measures they have to take in order to mitigate that risk of exposure in closed settings.
Thanks, Elsa.
And I'd add in that situation, if there were any other employees in that space, right now, as you know, we're not asking each individual employee for their vaccination status. So if an employee volunteered, the manager would know. But if they didn't volunteer right now, they wouldn't, be required to ask or shouldn't ask.
Great. Terry, I think this question is for you. Will the university have a requirement or recommendation regarding plexiglass remaining in place for face-to-face customer interactions?
Thanks, Tyson. So this, the question about plexiglass has been posed, and the use of it as a mitigation measure is a little controversial. And so really the state hasn't continued to recommend plexiglass, but at the same time, we're not going to, recommend people remove it in existing locations. So, so basically any new installations will not be recommended. However, if people want to talk about their particular situation, about where plexiglass is existing, happy to take those questions. So EHS can answer those on a case by case.
Thank you. So much of our conversation has been around re-entry in the fall semester, but this question just came in. Are the social distancing and masking policies described in the President's June 29th email to employees also in effect for the remainder of the summer?
I think you're on mute. I think you're on mute, Chris.
It still happens. So I think just to say that many of the requirements, including masking, were already in place. But the message from Andy refined that for all of us. And Andy, it's my opinion that they're immediately in effect.
Great. I think we have time for one more question, and it just came in a moment ago. And Provost Lejouet, I'll look to you for guidance on this. How will classes work if we're supposed to stay 6 feet apart? From what I've seen, classes are filled with people sitting relatively close to each other. I'm just wondering if classes will be restructured or if there will be different times for the same class to attend if one of the times is too full.
Yeah, so at this point, we're assuming there won't be social distancing. Now, we do have a backup registration in place, and if there is a requirement of 3 feet or 6 feet, we will adjust. But our expectation, and this is supported by the requirement of students getting vaccinated, that we will be able to operate in classes the way we have traditionally.
Okay, well, thank you to all the panelists. We've managed to get through every question we had in the queue and that came in live in 57 minutes. So well done there. And Dr. Andy, I'll turn it back over to you to close things up.
Yeah, well, thank you, Tyson, for shepherding us through that quickly, and thank you to the panelists. But most of all, I want to thank everybody out there who's listening in and watching this. And look, the information isn't perfect at this time because so many things are changing, as you know, whether it's the Delta variant that we're watching, whether it's guidelines from the state or from others. But I can commit that we're going to try our best. If we have to have town halls more frequently, if we have to have more frequent communications to be able to adapt to the changing landscape, we will. And keep your questions coming in so that we can know whether there are specific points that we need to clarify. But also keep your suggestions coming in as well. A lot of you, I mean, this is a university, so it's full of brilliant people, and keep bringing those suggestions and those ideas as we move forward. And most of all, stay safe and have a wonderful summer. So thank you so much.